Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Preparing for Surgery, Part 1, Introduction. Millions of surgical procedures are performed each year around the world. This program will help you prepare for surgery. By understanding the different steps, you can help your healthcare providers ensure a successful operation and a fast recovery. A planned surgery involves 4 distinct steps: surgical consultation, pre-surgical visit, day of surgery, patient discharge. During the surgical consultation, the patient meets with his or her surgeon to discuss the surgical treatment options and the benefits and risks of surgery. This program is designed for patients who have already been scheduled for surgery. The purpose of the pre-surgical visit is to check the medical condition of the patient and to plan for anesthesia. This program discusses what happens during the pre-surgical examination and the medical questions you may be asked. On the day of surgery, the patient checks in before going to the operating room. After the operation, the patient is monitored in the post-anesthesia care unit. Other programs in this series cover the events of the day of surgery. After having surgery, the patient either stays at a healthcare facility or goes home. When patients go home, they are given instructions. Other programs in this series will discuss the discharge process. Waiting for surgery. After you have made the decision to have surgery, there may be a waiting period of as little as 1 day or as long as several weeks. On the following pages are some preparation tips you might use to prepare for surgery while you are waiting. Find out from your healthcare provider whether you are going to be an outpatient or an inpatient. Outpatient means that you go home the same day that the surgery is performed. Inpatient means that you stay in a healthcare facility after the surgery for 1 or more days. Your surgeon will tell you the dates of your admission and surgery. If you have family members to take care of, make arrangements for someone else to care for them while you are in the healthcare facility. Sometimes it is not possible to know the exact time of the surgery until the business day before the actual date. If this is the case, you will need to find out when you will be notified of the time of surgery. Ask your healthcare provider if you should change the schedule and dosage of any medications you may be taking. If you are a smoker, it is best to stop smoking before surgery. This helps ensure a faster recovery. For this to be really helpful, you should stop smoking 2 weeks before the date of surgery. Your healthcare provider will tell you if there is a risk of a large blood loss during surgery. Sometimes this can require a blood transfusion. If you are healthy and your operation is more than 4 weeks away, you might have an opportunity to store some of your own blood in case a blood transfusion is needed. When a person is given a transfusion of their own blood, it is known as an autologous blood transfusion. Pre-surgical visit. The pre-surgical visit is usually the day before surgery. During the pre-surgical visit, an anesthesia specialist examines you and reviews your medical history to determine what type of anesthesia is safe for you. Anesthesia is a combination of medicines used to keep you comfortable during your surgery. To help determine the safest and most effective combination of medicines, the anesthesia specialist will do a physical exam and ask you questions regarding your health. Blood and urine tests, as well as heart tracings called EKGs, may be needed. It is important to let your healthcare provider know if you have had blood or urine tests or EKGs in the last 30 days. This might eliminate the need for more tests to be done. If you have had any of these tests, you should either send the results to your healthcare provider ahead of time or take them with you to the pre-surgical visit. If you do not have the test results, you may be able to ask the healthcare provider that has them to forward them to your current healthcare provider before your pre-surgical visit. Be prepared to answer a lot of questions. On the following pages are some examples of questions you might be asked. What prescription medications are you taking? Are you taking any non-prescription medications? Do you have any allergies to drug or food groups? If yes, what are you allergic to? Are you allergic to latex? Latex is a substance found in many healthcare facilities and surgical accessories. It is possible for your healthcare providers to avoid exposing you to latex if you have a latex allergy. Have you had anesthesia before? If so, were you allergic to any anesthetic drug? Do you know if any blood relative of yours has had problems with anesthesia? You should tell your anesthesiologist about any medical problems that you may have, such as heart, lung, or kidney problems, strokes, liver damage. You should report the following disorders and events to your anesthesiologist: previous blood transfusions, diabetes, high blood pressure, jaundice, depression, and other psychiatric disorders. It is also important to tell your healthcare provider whether you have snoring problems and whether you have any loose teeth or dental work, such as bridges or crowns. Medications you may be taking could interact with anesthesia or could cause excessive bleeding during surgery. It is very important to tell your anesthesiologist and surgeon about any medications you may be taking, even over-the-counter medications such as aspirin, Advil, ibuprofen, or herbal supplements. Your healthcare provider may ask you to change the schedule and dosage of your medications before the surgery. You should also inform your healthcare provider if you drink alcohol on a daily basis. Some precautions may need to be taken to prevent you from suffering from alcohol withdrawal after the surgery. Based on your answers, the anesthesiologist and surgeon will determine the best anesthetic for you. There are 3 general types of anesthesia. 1. General anesthesia. 2. Regional anesthesia. 3. Local anesthesia. General anesthesia causes the patient to go to sleep and not feel pain. General anesthesia is either given through a mask or an injection. Regional anesthesia is used when a whole region of the body, such as an arm or leg, needs to be numbed or anesthetized. Examples of regional anesthesia include spinal anesthesia, epidural anesthesia, and nerve blocks. Local anesthesia is used for numbing specific limited areas of the body, such as a skin area. You may have already experienced a local anesthetic if your dentist has ever numbed the nerves of one or more of your teeth. Due to advances in technology and medication, anesthesia is extremely safe, but there are some possible risks and complications. You can do a lot to prevent them by telling your healthcare provider about your allergies, medications, and diseases. The risks depend on the type of anesthesia you will have and on your current medical condition. Your healthcare provider will discuss these risks with you. Most patients are admitted to a healthcare facility on the day of surgery, but in some cases the patient may need to be admitted the day before. The next section discusses what you may need to do or not do at home before the operation. Your surgeon or anesthesiologist may give you more specific instructions. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. The night before surgery. To avoid complications during and after your surgery, you must limit what you eat and drink. During surgery, it is possible for the food in the stomach to be vomited and inhaled into the lungs. Do not eat, drink, chew, or suck on any food after midnight before your surgery. This includes gum, mints, and candy. If you have diabetes, ask your healthcare provider when you should eat last. The medications your anesthesiologist asks you to take should be swallowed with a few sips of water right when you wake up on the morning of surgery. If you are a smoker, it is best if you stop smoking before surgery. If you cannot stop smoking, you should at least cut down how much you smoke and stop smoking after midnight the night before surgery. You should not drink any alcoholic beverages within 24 hours of the surgery. Your healthcare provider may also ask you to shower and scrub the planned incision area with a special disinfecting soap. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Thanks to technological advances, surgical procedures are now much safer and less painful. Recovery from surgery is also faster due to new anesthetics and less invasive surgical techniques. The patient plays an important role in ensuring the success of surgery. This program will help you understand the surgical process and prepare you for how you can play an active role in your treatment and recovery. Your healthcare providers are available to answer any questions you may have about your scheduled surgery. Thank you for using Explain.